वारे वाह
मसाला चाय।
जय दोस्तों, आप सुन रहे हैं मसाला चाय। एंड पिया बार बार मेरे से ये सवाल पूछती है, कुलराज, व्हेन आर यू गोइंग टू लूज वेट?
Kulji, you do need to lose weight, those extra pounds which you have put in this winter. You know, you have been just...
all those parties and all those amazing celebrations and khana and,
Khana and pina and...
Pia, that's why I have with me Dr. Chandra from Jersey Medical Weight Loss, and she's going to help me and help all our listeners to lose weight and feel great.
Absolutely. Let's welcome Dr. Chandra from Jersey Medical Weight Loss. Welcome, doctor. How are you?
I'm doing fine. Good evening, everyone.
Good evening to you, doctor. Tell us, what is obesity?
Okay, let me start with first thanking Mr. Kulraj and Pia for having me on your show. And I would like to congratulate your team for doing an awesome job to our Indian community through AK Radio.
Thank you.
Okay, so you're welcome. So let's start with the definition of obesity. Obesity is a condition in which excess body fat is accumulated to such an extent that it negatively impacts one's health. Obesity and overweight is now recognized as a chronic disease state, just like diabetes and hypertension, and no longer considered as just a behavioral issue with overeating. So we categorize obesity and overweight using a body mass index chart. So now, what is body mass index? It is a ratio of weight in kg divided by height in meter square. So there are a lot of online tools available to calculate your BMI, or next time when you visit your doctor's office, ask them about your BMI to find out about your weight status. BMI anywhere between 18 to 24 is considered as normal. So if your BMI is between 25 to 29, so that is considered as overweight, and any number 30 and above is considered as obesity.
So, Dr. Chandra, just tell me, what are the causes of, we see a lot of obese or overweight people. So what are the causes? What makes them that?
So the weight issues are multifactorial. There are environmental factors, cultural factors, medical problems, genetic factor, medication, lifestyle, and psychological factors that are involved in the weight issues. So we live a fast-paced life with little time to plan and prepare healthy meals. And secondly, our physical activity is very much limited these days, with drive-through fast food joints and mobile apps literally delivering food to our doorsteps. So our lifestyle has contributed a lot to the rising epidemic of obesity. Secondly, there are medical problems, and medication used to treat certain medical problem that itself may be the culprit in causing the weight gain. And genetics, as we all know, plays a huge role in determining who's going to be obese. I would say that we are all stamped at birth, but there is nothing we can do about it other than being proactive in cultivating healthy lifestyle.
And once again, for the listeners who just tuned in, we are in conversation with, that's Dr. Chandra from Jersey Medical Weight Loss, and we are, of course, talking to her about the issue. So tell me, doctor, what are the diseases that are caused by obesity?
So there are about 53 plus diseases associated with obesity. To name a few: hypertension, type 2 diabetes, heart disease, stroke, sleep apnea, osteoarthritis, and you may be surprised to find even cancer like endometrial, breast, and colon cancer that have been linked to obesity.
So can you give us some statistical data about the prevalence of obesity?
Sure. So according to Center for Disease Control, more than 1/3 of U.S. adults have obesity. And from 2000, there has been a significant increase in obesity in both adults and youth. The prevalence of obesity is much higher in women compared to men. And second, only to smoking for death, it is considered as the most preventable cause of death in U.S. So these data are quite alarming and sends us a strong message to act right now.
And what is, doctor, medical weight loss? Can you explain the steps involved in that?
Yes. Medical weight loss, also known as bariatric medicine, involves identifying the root cause of obesity and treating it with medication. So as the name suggests, there is no surgery or any invasive procedure involved in my treatment. My approach to weight loss involves a comprehensive and customized treatment for each and every patient, since every individual is different. So in my office, we start with a body composition analysis. So we do it with using a special scale to calculate fat, muscle, and water weight, and most importantly, your metabolic rate, which is key in determining your meal plan. So during a consultation, we do a complete workup with EKG, blood testing, and physical examination.
And folks, if you just tuned in and if you're listening to us, we're talking to Dr. Chandra, and she's from Jersey Med Weight Loss, and a lot of people have taken advantage of the facility, and the whole team is ready to help you, guide you. And they also have a cool sculpting event on April 14th, which is also an FDA approved one, and the location is 1527 Route 27, Suite 2100. The phone number is 732-201-3504. The website is jerseymedweightloss.com. My next question to you, doctor, is how do you treat a patient with weight issue? What are the treatment options available?
Okay. As I mentioned, every treatment plan is individualized to treat patients' metabolic and caloric needs. The treatment includes a detailed diet plan, exercise, and medication. In terms of medication, I prescribe FDA-approved weight loss medication to help patients reach the goal weight effectively and, most importantly, safely. So during the treatment, they'll be closely monitored with vitals, physical examination, and blood testing done periodically. So I treat adults 18 years and above at my clinic.
And, doctor, just tell me, how much should a patient, lose to improve the status of their health?
Sure. So weight loss of 10% itself will lead to a huge improvement in one's health status. So weight loss of 10% leads to 30% decrease in body fat, which in turn improves your blood pressure, sugar, and cholesterol level. Secondly, weight loss of 10% leads to 50% decrease in the severity of sleep apnea. So if you see, sleep apnea is a major disease condition associated with weight, and it significantly impairs one's health. So decreasing your weight by 10% leads to 50% decrease in the severity of sleep apnea. And also, modest weight loss of 5 to 10% itself improves your mood, energy level, and overall health. So I would say to have a short-term goal of 5 to 10%, and always you have to have a long-term goal to get your ideal BMI.
Once again, for the listeners who just tuned in, we are talking to Dr. Chandra from Jersey Med Weight Loss, and of course they are located at 1527 Route 27 Suite 2100, and they also have a CoolSculpting event which is on April 14th, and as you all know that CoolSculpting is FDA approved, and you can call them at 732-201-3504, and you can also log on to their website, that is www.jerseymedweightloss.com. So, doctor, to wrap it up, what's your advice for a person struggling to lose weight?
So obesity is a serious but very much a treatable health condition. There are a lot of options available now, but with so many fad diets in the market, I would strongly advise to be cautious and always go with a medically supervised weight loss treatment, which will not only help you lose weight safely, but also to keep it off effectively.
And doctor, you have this event, CoolSculpting event on April 14th. Can you give us an overview what exactly you'll be doing in that event?
Yes. This is a Mother's Day special for
Mother's
our,
Day special. Wow.
Yes,
Great.
for wonderful moms, titled Moms and Muffin Tops.
Mm-hmm.
We're going to be focusing mainly on CoolSculpting. So, as you had mentioned, it's a FDA-cleared body contouring treatment to freeze away fat. So we're going to be doing a live demonstration, slideshow, and a free assessment on another fun stuff. So I would like to invite you all, and we're going to have, it will be a educational seminar as well as very informative, and you can have, it's like an open house to have a look at our facility.
Doctor, I want to come and I really
That's
want to.
what my question was. So can, dads also join it?
Dads come, sure. Yeah.
I want to freeze
Moms and dads.
all my,
Fat.
fat cells.
Your muffin top.
And so
that
nice
is
of you,
everyone's
doctor.
problem.
There are people like you in society, in our community, who take time out and come on the radio and support the community radio also, and of course talk about obesity, which is a leading cause for so many problems, health problems, and I think this is a great initiative. Thank you so much for joining us. We want all of you at your Jersey Med Weight Loss have a wonderful evening and all the best for your event.
Thank you so much. It's been a pleasure, and thank you very much, Mr. Kulraj and Pia.
Thank you
and
so much.
HT Radio team. Okay,
Thank you so
Thank
much.
you.
It was a pleasure
Bye-bye.
talking to you.
Drive
Thank
safe.
you.
Thank you.
Bye.